This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. We're at Aurora Health Center in Oshkosh, and we're going to be heading over to the orthopedic department. We're going to be talking with Dr. Lauren Potter about rotator cuff injuries. Well, thank you for joining us once again. Today we're talking about shoulders and rotator cuff injuries. So what is a rotator cuff injury?
Well, a rotator cuff injury, first we have to describe what the rotator cuff is. So this is a model of the shoulder with the deltoid, the large deltoid muscle, which is the big muscle that you feel on the outside of your shoulder, taken away. And underneath is a series of tendons, 4 different tendons, one coming from the front, one coming from the back, and one coming from the top, and 2 coming from the back, that all attach to the shoulder itself. And here's the ball and the socket inside the shoulder. And what the rotator cuff does is it controls those fine movements that you have out in space. So the deltoid is very powerful, and it can get your arm up above your head, and it can hold things above your head and hold it here. But without the rotator cuff, you don't have control of that, so you'll end up with weakness in the mid-ranges as you try to put away dishes into the mid-shelf, or you try to move your arm across your body or to the inside. And it really controls the fine movements inside your shoulder itself as the ball moves in the socket itself. So a rotator cuff injury, what that is a portion of this tendon here. So the muscles sit on the backside, on the top and in the front, but then they attach to tendons, which attaches to the bone. And one of the tendons will tear and retract back away from the humerus, or the ball of the shoulder, a little bit, and it tears off. The problem with that is there's fluid inside your shoulder that cushions the shoulder, and so that gets in the way and doesn't let it heal down. The other thing is the muscles have a constant pull like a rubber band. And so these tendons themselves will continue to pull back from this, and they'll never be able to reattach themselves back on. And the other thing is it's kind of like it encases the whole head. So if you tear a little bit of it, you start to tear a lot more of it to the point where the whole rotator cuff tears. And at that point, you are not able to get your arm up above waist level. And that would be a massive, massive tear. Normally, they're a small tear of 1 or 2 of the tendons right on top of the head itself. And that's what a rotator cuff injury is.
Okay. I think a lot of sports fans have heard that term, rotator cuff injury, and they associate it with baseball pitching. But what are some of the other activities that could happen to me or you that would cause a rotator cuff injury?
So it's a bimodal distribution. There's 2 subsets of people that get a rotator cuff injury. There's those in their 50s to 60s to 70s to 80s, and even a little bit earlier, and then there's overhead throwing athletes. So the overhead throwing athletes is more of a too much range of motion as those people rear back to throw, and that's a wearing and an abnormal motion. But in everyone else, whether it's from a fall or even from raking leaves, or probably about 60% of people don't even know what happens. Just all of a sudden they have pain on the outside of their shoulder, and they can't lift their arm up as well, and they're having a hard time taking the plate out or the pot out and putting it on the top shelf. And that comes from, as the tendon gets a little bit older, it becomes more like leather, like older leather, and it starts to dry out a little bit, and it's more prone to tears. Another thing that causes them quite often is a fall on an outstretched hand. And you don't break a bone or something like that, but as the shoulder itself comes back, a piece of that older leather will tear loose, and the tendon can tear loose from the ball itself. And like I said, the biggest problem with that is that it will not reattach itself, which is a common thought, that maybe it'll just reattach itself. And then you will have a hard time getting your hand up in front of you and doing those things. Some people are unaffected by it at all and just have some pain on the outside of their shoulder, usually coming down into the mid part of their shoulder. And a lot of the time, after the tear, it bleeds into there a little bit, and that is very painful.
Okay, are there other signs or symptoms besides pain in the shoulder that would lead a person to believe they might have a rotator cuff injury?
The weakness is probably one of the biggest ones, but usually pain is the first thing that comes along in the shoulder. The second thing is the weakness. At the point where weakness is, we're usually dealing with something that's a little more chronic. Interestingly, when they do cadaver studies on people, they find that almost 60% of patients themselves or cadavers have a rotator cuff tear at the time that they die, and they didn't know that they had it at all. So asymptomatic tears are very common, and we don't even know who has those, and they don't affect your function at all.
Okay, at what point should somebody seek your assistance on if they think they might have a rotator cuff problem?
If you have pain that lasts more than 2 weeks, usually you should be seen to have your shoulder looked at. After 2 weeks and some anti-inflammatories such as Advil or Aleve or something like that, if your shoulder is still giving you some problems, you should be seen. And definitely if you start to notice weakness in it, you should be seen much quicker. The problem is that at points along the way, the rotator cuff can no longer be fixed. If that tendon retracts far enough, it can't be brought out to where it had to be at one time, and then there's a lot more problems with the shoulder.
So don't wait.
So don't wait.
No.
Do not wait on this one.
Are we talking about surgery immediately when we find out there's a rotator cuff problem, or are there other treatment options?
Depending on, a lot of times it'll just be part of the rotator cuff will be torn, just half of the tendon, versus if a full tendon is torn away, I usually recommend if it's causing pain and disability, that the only way to really get that to stop is with a surgical intervention. But if it's a partial tear, which is a number of the times, they usually do quite well, patient does quite well with an injection or with physical therapy or with both. And the physical therapists do a wonderful job of working the shoulder and actually strengthening the back muscles. So when you strengthen the back muscles, it brings your wing bone back and your shoulder is able to move much freer. And that has about a 70 to 80% success rate with non-operative management, with just a good shoulder physical therapist and often a cortisone shot in the shoulder.
Okay. And you don't only handle rotator cuff problems. What are some of the other conditions that you treat?
So I treat, most of my practice centers around treating the hand, wrist, elbow, and shoulder. And then I also do general fractures, total hip and total knee replacements, and knee arthroscopies. With the shoulders themselves, most of my surgery is done arthroscopically. So it is done through minimally invasive approach, where you, instead of having a large incision on the anterior aspect of your shoulder, you usually have 3 or 4 small 1 centimeter poke holes that I do all the work through, and it's on a camera. So I think that without having to detach the major big muscle, the deltoid, it helps with pain relief, and the fixation is the same whether you do it through a big incision or with a small little poke hole, so you don't end up with a big scar on the outside of your shoulder.
I would imagine this keeps you pretty busy.
It does, especially during the winter time.
I bet. I bet. Now, if a person would like to come and see you, would you like them to have a referral, or can they make an appointment directly with your office?
Either way is just fine, but if they do have shoulder pain that's been going on for a while, especially if they have weakness, they can just call into the office and we'll set them up at their earliest convenience.
All right, Dr. Potter, thank you for taking some time today.
Thank you.
If you'd like to know more about rotator cuff injuries or to schedule an appointment with Dr. Potter, you can call Aurora Health Center in Oshkosh at 920-303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.